Okay, so welcome back, and in today's video I want to be talking about how to edit, or I'm going to show you how to edit cosmetic photos. And these are, the series that we're doing here is just particular to our office, and this is a cosmetic case that was done on I think she was like in her late 20s, but she had some damage to her teeth, some erosion going on, and I'm just going to show you my quick editing process. Now the more you do this, the easier it's going to get. So I got my Lightroom Classic open up here, and what I want to do is click on Library. You have to be on that in order to import. And then I'm going to click this import button here, and then it's going to open up. Now these photos, I saved them onto my desktop, and I do have the portrait photos, but I'm not going to do them on this tutorial because of HIPAA, and I don't want to really do a whole lot of editing to that because it's not enough. It's not worth it, I guess, to edit full face on these tutorials because it's basically the same process. And to tell you the truth, I don't really do a whole lot of editing to the portraits. So let's go. It's going to be in the hard drive here. Click on that. It's on under me. Go to the desktop. And it is, I believe it's demo 1. Oh, I guess I do have the befores and afters. Okay, so not that one. Alright. Okay, so I do have the befores and afters. So what I'm going to do is I want to import the befores, and then in the next video I'll edit the afters, and then another video I'll show how to put it all together onto Canva and to have a nice presentation so you can post on Instagram, Facebook, whatever. And I'll show you basically some things that I do for making stories out of every case for Instagram. So we'll go ahead and highlight those. Okay, now it's going on to my Lightroom import. Oh, good. Go here. Okay. Now okay, here they are. Okay, so this was in 2011. Okay. So these are just right now. They are on the hard drive and basically the photo library. So what I have to do is bring them onto or into Lightroom Classic so I can edit them and save the edit. So I want to close that a little bit, and then I'm just going to name this person Demo 2. I think that was what I called it. So Demo 2. And you notice that it already imported one photo. Now, if you want to import, if you just want to import all of them and then create a folder, you can do that. It's just as easy, but I always forget to do that. So, but that is a trick that you can do whenever you're importing these. So what I want to do is grab these other photos that I didn't get, and then I want to drag them into the collections. Now, the collections is where you're going to put all your patients' names, and those are all the edits. So if you move the photos from the backup or from up here because they're being stored. Where did I put it? Oh, they're on my hard drive. They're being moved. All these photos, all these folders here, if you move them at all, if you mess with them at all, it's going to disrupt your edit. So make sure that you don't do that. So you have to know what you're doing when you're doing the edit or when you're moving folders around. All right, so let's go to the demo here, and now you'll notice that I have the teeth on the bottom. If you don't see the teeth on your Lightroom Classic, then what you're going to have to do, there's a little arrow here. You can click it and unclick it, and it'll bring up all the photos. Now, the reason this is important to have up is so that you can compare some of the photos that you're doing, and you can compare your work and see the proportions and where you need to get everything. All right, so let's start with this one, and we want to highlight that, and then we'll go ahead and click on develop. You can click on this one or you can click it down here, it doesn't matter. Alright, so let's go to develop. Now I do this really quick, so like when we get this person as a new patient, I'll do these edits really quick, but right now I'm going to be slowing down, but I do it really quick in the clinic so that they can be put up. So the way it works is the doctor will maybe come in, or if he has time, but usually it's the dental assistant that is bringing the patient back, and they're the first ones talking to him, and we will go ahead and I will start with the photos, and then while I'm uploading those photos, the dental assistant will do an iTero scan and just talk to her a little bit, and by the time the doctor comes in, everything will be ready to go for the patient or for the doctor to give a presentation. And it's really impressive for the patient to see the photos and the efficiency of how our workflow, and I think that's a really big selling point. So the photos, if they're really good photos, they'll be impressed because no other office does that, and probably you might not even do that. But whenever you show that you are detailed oriented and you can bring a patient into a room, it really sells them, in my opinion, and in other doctors' opinions, it really sells them, and it separates you from other practices. So if you don't have that workflow in your practice right now, I highly, highly recommend that you do that. And another thing that you can do is you can give them the pictures so that they can look at them at home. That's another option too. All right, so let's go back to developing. So we want to click on this box here with the arrows going around the box, and you want to click on that. And I think the default is, oh, I don't have a default, but the customary is a 2x4 or a 2x1. And what we'll do is here we'll go 2x4. Now this is a perfect half square, I guess. A perfect rectangle, I guess you could call it. Now this, later on, will make more sense to you why I have these dimensions, but basically it's so that when I put them in a before and after, they fall right into place inside of Canva. All right, so we're going to center these up. I use these grids as kind of like where to center the front teeth. All right, 8 and 9. So that's about right. Now I wouldn't get too anal retentive about exactly where these teeth are, as long as your next set of photos are generally within this area, because you can, inside of Canva, you can adjust it a little bit. Okay, now depending on what this photo is being used for, if this patient was going for an all in X, then I would not rotate left or right, because I want the general, I want the lab or whoever I'm sending these photos off to see the cant in the face, if they have one. This person has a little bit of a cant, but I'm not going to really adjust it. So, but just keep that in mind, okay? So hit that. All right. Now she has a little bit of things, a little bit of, looks like alginate on her face here. Okay. So what I'm going to do is zoom in, which is Command plus. All right. And you can zoom in there like that. And I see that little piece. Now what you can do, if you see little blemishes like that, I'm also going to be taking out some blemishes in their face, because when you're presenting these pictures to the patient, they don't want their face on the screen showing zits and scars and things like that. So I do them a little favor. Now what I'm going to do is I want to go to heal, make sure that's on heal, and then what you can do is bring this down with the wheel on the mouse, or you can adjust it here with the size, and I'm just going to zap it. And what it's going to do is basically clone. Now you can feather it depending on how much you want to cover it, or how you can change the opacity. So that's all I'm going to do. Hit enter, then you want to click on this again and it'll take that away. And you can kind of see what it did. Now it doesn't look like it's too did too much work there. But so if this is not looking right, you can always move this part of the circle here to find a spot that you can use to cover up. And okay, so I'm going to make it like that, and I'll probably go to something like that. Okay, then click that, and you can see I got rid of this, got rid of the blemish there. So you want to zoom back out, just like that, and the same thing down here at the bottom. If you want to get rid of this blemish there, you can click on the heal button, and you're going to zap it just like that, and it takes it away. Because what it's doing is this area that you see here, it is actually grabbing from a different piece of skin, the most similar piece of skin that the AI can find on the computer. So that's how you do that. Okay, so that looks pretty good. I'm going to zoom out. Now, say you want more contrast, more clarity on, if you're using this image for Instagram, then most of the time you want it to pop out, okay? And the way to do that is by using the clarity slider here. And now the clarity will make it just a little bit sharper. You can see there it makes it a little bit darker, and if I did that, you can see that it just makes things sharper. Now if I want to brighten it up because it's too dark, and I see this a lot of times on Instagram, is the teeth aren't bright enough. You can tell, like, man, this looks underexposed. So if you want, that's why it's important to shoot in RAW, because you get more data from the image that way. So what you want to do is boost up the exposure just like that. You don't want it too bright, because when you're editing on your computer, your screen is not calibrated to the color science of your phone. So what you're going to find is that you may be like, oh, I made that really bright inside of Lightroom Classic, but then whenever I posted it on Instagram, it was a little bit darker or maybe too bright. So you have to kind of learn what your computer, what your screen is showing you, and how it translates onto a different platform, Facebook, Instagram, whatever. Okay, so that's where I'm going to keep it right there. Now, I don't want to keep changing the exposure to all these photos. So what you can do is actually sync all the colors up. So you can click on the first one. Always, if you're going to try to sync the colors up, you have to click on the one you want, and then the following photos that you highlight are going to be following the first one that you wanted. So I want everything to replicate the exposure of this one. So I want to click on that, and then I want to click on the ones that I want to change, these two. Alright, and then you go to this sync button here, and then you're going to have a bunch of options where you can change the exposure, the contrast, the highlight, shadows, whatever. And then you hit synchronize, and then it's going to match them just like that. I don't know why this one didn't just do it. Oh, there it is. Okay, so my computer's a little bit slow. All right, and it matches the skin tone perfectly, and that's what you do for your befores and afters. But now you only do 3 at a time. You don't want to go in here and change the exposure on these intraorals, because it's going to mess everything up. So you want to take the beginning of these intraorals and adjust it, and then basically synchronize these 3 photos. So I want to go ahead and crop these in. Again, like I said, it doesn't have to be perfect. You just have to get in the ballpark. I don't know why this is going to 2 to. Usually I have 2 to 4. Is that this? Is that the same thing? Okay. Enter custom 2 by 4. All right. All right. So I'm going to bring this in down a little bit like that. And what I normally do when I'm doing these side profiles, I try to get this grid line here on the left right on the midline, just like that. Alright, and then I'll go to this one. My computer is a little bit slow, I don't know why, but you can see that it's matching up. Okay, you can try to match this up with the frontal shot, but you don't have to. It's up to you. And then we can go here, enter a custom. Eventually, the program's going to learn your specifications, and it will remember everything that you are inputting into the computer. So, all right. Now this one's a little bit different. Let's see if I can get a little bit closer. Now, if you use the midline for your center point, it's not always going to line up. Let's see here. Does everything look okay? I think I'm going to make this just a little bit bigger. Now, this is just me being anal retentive. You don't have to worry about this really so much, because you can adjust it inside of Canva when you're doing your final before and after. Okay, it looks good. So those are your 3 befores and afters. And I'm going to go to the intraorals. I want to do the same thing. I want to bring this down 2 by 4. Like that. Just like that. Now, when you're using Lightroom Classic, you might get this effect where everything kind of looks blurry. It's kind of doing a preview. It's because your computer's lagging and you probably need a little bit more power. So I'm editing on a MacBook Air, a 2021, if that gives you some kind of reference of how much power you need. Let's see here. It looks good. Now, I think the lighting on this is pretty good. I don't think I really have to do anything for that. Okay. Now, I know a lot of doctors like to frame things up first before you take the photo, so you don't have to edit, but in reality, you're going to have to edit anyway. And I hate it when people say that. It's like, oh, you got to frame up your photo. It's like, no, you don't. You just, because you're going to be editing it anyway. And besides, it's very hard to get it every single time perfect. But you can perfect it inside of Lightroom. And that's why I love this program. Alright, let's go here. Alright, so you can see I'm just roughly doing this. And this last one, these are the contraster shots. So if you are doing contraster shots, it's very important that you, when you're using the contraster, you have it more of at an angle, like high like this, versus flat. I see a lot of doctors taking photos like that. That's not the correct way to do it, because what ends up happening is you can see a glare right on the edge of the contraster, and then it's kind of a pain in the ass to get rid of it. So I highly advise that you do not do that. Alright, so on these, I like to put the teeth as, oh, I'm going to show you. I like to put the centrals right on the bottom grid line. Alright. And there you go. Now, the exposure, since I have my camera set on auto exposure, this first set, these first three of the smiling, are going to be a different exposure than these three that are intraoral, because the light changes. So these have to be the same. These have to be the same group together. You know, they don't have to be the exact exposure themselves. They don't have to match up. It's just, you know, this group with, you know, these first three have to be the same exposure. These second three have to be the same exposure if you want to make them look really good. And the third one, usually what happens on the contraster shot, if you're using lights, is it gets overexposed because of the contrast from the black from the contraster. So usually what I have to do with the contrast shot is bring down the exposure just a tad so you can see a little bit of detail in the teeth. Now remember, the more you expose the teeth, the less detail you see, a less structure, tooth structure you're going to be able to see. So just keep that in mind. And that looks good. Okay, so what I'm going to do now. So whenever you are exporting these photos for a presentation or for importing them into Canva, you need to highlight all of them, the ones that you want to take, and then you go to File, and then you go to Export, and you can put them in a folder to put on your desktop. You can put them wherever. You can change the name, whatever. And I'm going to put them in a folder, and then I'm going to have them as a JPEG, because a JPEG is usually smaller than a PNG, and PNG is actually what you want on Instagram, Facebook, because it's a web-based type of photo. It's really good for resizing, so it doesn't lose clarity if you do that. But we're going to convert it to a JPEG, upload it to Canva, and then when we download the full collage of photos, it's going to be downloaded in PNG files, and then you can upload it that way to Instagram. So I'm going to make this to a JPEG. We want to do 300 megapixels. In case you're wondering, whenever you're getting pictures printed from CVS or Walgreens or any place, 300 is the resolution that you want for clarity. The best image quality. A magazine guy told me that, so I started doing it, and it turned out great. So now we are going to export, and you can see right here it's processing. And also, whenever you're done exporting and you're done importing into Canva, it's a good idea to go ahead and put these before photos inside of the patient's folder. Now what we do is we use just a regular Windows file manager, and we just on the server, and it's called patient photos, and then we alphabetize them. Like there's the A folder, B folder, C folder, whatever, and it organizes them really quick so that you can find them for the presentation. So the doctor will go in there, he'll look for the photos, and bam, they're there. It's kind of it's our workflow, and it works really good for us, so I would highly recommend it. I wouldn't use EagleSoft. I wouldn't use any other program's internal photo management system, because if something happens and the system crashes or whatever, or they hold you hostage or hold your information hostage until you pay them, then they have all your photos, and it's just a lot easier to store like your befores, afters, social media. If you want to have, we have a showcase folder where we put all our befores and afters, the social media presentations. We put them in the their folder so that we can bring them up later to show patients, oh, this is what an all-in exit looks like. Oh, this is what 6 veneers looks like. This is what 8 veneers look like. This is what 10 veneers look like. So it's very easy to show patients what they can expect as a result. Okay, so we minimize that, and it's going to be right here. Like I said, and then when you bring them up, you'll see the these images in the patient folder. All right, so if you have any more questions about what I just showed you, leave them in the comment section below. If not, you can watch the next video, and because YouTube thinks that you're going to like those videos the most, and it will really help out my channel. So until next time, I'll see you later. Take care. Bye.